in natural medicine, we have a little bit different way of thinking about it to some degree. So in natural medicine for anything, we want to get the basics in place. You have to have nutrition, you have to have exercise, sleep, low stress, time in nature, socialization, having fun, relaxing. All those things are just part of being human. We need those things to be able to function, to be able to heal, to be able to enjoy our lives. We also need vitamin D. We cannot have anemia. If we have any kind of anemia, that has to be treated in order for any healing to occur. Our digestion has to be up to par, and we need to be pooping at least once a day. Our hormones need to be balanced. We need to take care of any inflammation or infection that we have. And then we need a life that's filled with creativity and curiosity. So one of the things that we would do in natural medicine for someone who is even in an early stage of cerebral small vessel disease is run some lab work. So the C-reactive protein is a generic inflammatory marker. We may run the highly sensitive C-reactive protein, originally designed for cardiovascular health, but now used in general, just to see. It's a more sensitive marker of inflammation. Homocysteine is another inflammatory marker. ADMA ratio to SDMA is a specific marker of endothelial damage. And so that's a really good one to run. And my lab charges $59, so it's not super expensive. The matrix metalloproteinase 9 is related to those white matter hyperintensities that we talked about. And so that's a good one to run too. My lab charges $59 for that one too, so not too bad. And then we want to look at coagulation. The fibrinogen is a good one for that. Also serum albumin and see if there's any albumin in the urine, or other things that we can do to kind of see how that cerebral small vessel disease is developing. So to be able to heal the endothelium, we need to reduce inflammation. And so there are a number of things that we can do for that. You could do all of them, you could do some of them. But a good way to start is with that delta tocopherol. That's vitamin E. It's better than the gamma or the alpha, and it's better than the tocopherols, which we used to use. Magnesium is also good. Vitamin C, CoQ10, lipoic acid, sesame seed oil, resveratrol, omega-3s, flavonoids, superoxide dismutase, silymarin, catalase, L-arginine, and L-citrulline will all help to heal the endothelium by reducing inflammation. So when we're talking about homocysteine, it's a part of the methylation cycle. So here you can see homocysteine right here. It's kind of like an end product of the methylation cycle that then is pulled into the transsulfuration pathway. And so in natural medicine, we really prefer to see the homocysteine 7, 8, 9, somewhere in there. That signifies a low level of inflammation that is below the clinical range. They will accept a level much higher than that. And so just based on the literature, we really want to see the 7, 8, 9 range. So homocysteine levels are dependent on folate, B12, and B6. So here we have the folate pathway, here we have the B12 pathway, and then B6 is what pulls homocysteine down into the transsulfuration pathway. So homocysteine has several choices. It can be pulled down into that transsulfuration pathway with B6, or it can be pulled up and methylated through this BHMT pathway in the liver to become methionine, or it can be pulled over and combined with methyl B12 to then become methionine. And so If we get high homocysteine, what this means is either we have low B6, and so we're not pulling the homocysteine down into the transsulfuration pathway. We could have a genetic SNP of the CSE gene that would back up homocysteine. If we have a genetic SNP of the CBS gene here, that speeds up the pull down of homocysteine. And so we would imagine that probably the people with high homocysteine do not have a CBS SNP. The other thing that can cause high homocysteine is if this BHMT pathway is backed up, if there is a genetic SNP for the MTR cobalamin pathway, so that we're not getting methylation of the B12 to pull up homocysteine. And also the B12 pathway will not work well if we have an MTHFR 677 SNP of the folate pathway. And so we need to do workarounds for these pathways if they have SNPs, so that we can help the homocysteine methylate or else be pulled down into the transsulfuration pathway, because ultimately homocysteine is one of the building blocks for glutathione, which is the master antioxidant. And so we really need homocysteine to be moving through the pathways in the way that it's designed. If you have high fibrinogen, or I mean, you probably will. There's risk of clotting with cerebral small vessel disease. And so we want to make the blood more slippery, and we do that with like the omega-3s or the tocotrienols. We also can treat the clots, digest the clots with a nattokinase, a lumbrokinase, or proteolytic enzymes between meals. We want to optimize glucose and insulin so we don't get any of that amyloid beta plaquing in the brain. So for glucose, we can use the bitter melon, the Gymnema sylvestre, amla, banaba, alpha lipoic acid. Of course, building more muscle and having more exercise, and chromium picolinate to control insulin and also rehab the beta cells in the pancreas, and to create more sensitivity in the cells that are going to take in the glucose. We use berberine, cinnamon, omega-3s, bergamot, resveratrol, turmeric, fenugreek, and Panax ginseng. Again, with the blood pressure, we have to find out what is the underlying reason for the hypertension. We need to treat that reason. And then for all blood pressure, for all high blood pressure, we want to use exercise, diet, lower stress, and more fun. To seal the blood-brain barrier, we're going to use turmeric, resveratrol, bicolin, apigenin, luteolin, rutin, catechins, vinpocetine, feverfew, butcher's broom, ginkgo biloba, cayenne pepper, B2, and magnesium. To support endothelial nitric oxide production, we're going to give L-arginine, iron, BH4, what the proxies of methylfolate and vitamin C. And for the NADPH, we'll use NADH and phosphate, and then make sure that we're in an oxygen-rich environment. Then to support the production, we'll use huperzine, phosphatidylcholine, and N-acetylcarnitine. So in Chinese medicine, microvascular disease is understood to be a loss of the collateral function, which are the arterioles and the venules and the capillaries. And so in Chinese medicine, they say that the underlying cause is really kidney deficiency, and that the treatment goal is to fill and nourish the kidney, blood, and yin essence, to remove stasis, and to dredge the collaterals. So I don't practice Chinese medicine, but I feel like it is such an ancient art that they have a lot of things figured out. And this is one of their tried and true interventions. And so I think it's something that is worth trying for everyone. Bouillon Wan Wu. We also want to decrease oxidative stress, which is to say decrease toxic exposures, heavy metal, tobacco, alcohol, drug, pollution, chemical exposures, cure infections, decrease stress, exercise more, and cut out all the processed foods, trans fats, and improve sleep quality. If we have had exposure to the oxidative stress, and we do have the reactive oxygen species, then we need to take antioxidants. So antioxidants are basically a lot in brightly colored fruits and vegetables, bioflavonoids, carotenoids, terpenoids, vitamin C, vitamin E, vitamin A, N-acetylcysteine, and the propionyl L-carnitine. These are like fantastic antioxidants, but just think brightly colored, eating the colors of the rainbow, eat the peels, get organic and eat the peels. So we have to optimize blood sugar, optimize estrogen, optimize endothelial function, and avoid the amyloid plaquing by optimizing blood sugar and insulin, optimizing zinc, copper, and iron levels, and again, optimizing estrogen. So while we're working on the endothelium, we can support the secondary nitric oxide pathway. This is called the nitrate, nitrite, nitric oxide pathway. It does not improve brain endothelial function, but it does produce nitric oxide. And so it's kind of like a systemic vasodilator. So for this one, we start by eating foods that are high in nitrates, like beets. And you probably, if you've ever turned on your computer or TV or anything, you've probably seen a million ads for beets and nitric oxide. And so this is the pathway they're talking about. So beets are high in nitrate, leafy greens, pomegranates, dark chocolate, watermelon, garlic, citrus. Those are all good sources. So what happens is you eat nitrate and then your microbiome in your mouth converts that to nitrite. You need to have the proper microbes in your mouth in order to make that conversion. Once you get that conversion from nitrate to nitrite in the mouth, you're going to take that nitrite down to the stomach, and you must have an acid stomach to convert nitrite to nitric oxide. So you can see there are places where this can go wrong. Also, we need to be in a hypoxic environment in order for this to happen ideally. So the things that can help with hypoxia are strenuous physical exercise, sleep apnea, who wants that? But this is the backup system, right? Diving, high altitudes, anemia. And so if our primary system is not working well, we're probably already experiencing suboptimal oxygen levels because we're not healthy. And so we probably don't have to try too hard to create a low oxygen situation. Is probably already at hand. In fact, the lumen of the intestine already in normal status has an oxygen level of only 2 to 7%. So you could really think of that as being an anaerobic situation. That would be really great for making nitric oxide. So, so these are the bacteria that are helpful for reducing nitrate to nitrite, and they're particularly prevalent in the posterior tongue. So they are a number of different phyla, 4 different phyla are represented. And the bacteria, the microbiome, of the esophagus is a little different from that of the mouth, and also that the nitrate reducing, or I guess it would be the nitrite reducing microorganisms in the belly are also a little different. So there's been some talk about what mouthwash does to the oral microbiome. For sure, you do not want to use any prescription mouthwash if you're like at home trying to just have oral hygiene. That stuff is serious and should only be used in serious situations, because it definitely will reduce the production of the reduction of nitrate to nitrite in the mouth, and in the blood. Listerine is less aggressive than the prescription mouthwashes, but it will reduce the nitrate reducing bacteria in the mouth. And so if you're going to use something like that, then it's a good idea to follow it with an oral probiotic, or possibly erythritol mouthwash, because erythritol appears to support the nitrate reducing oral bacteria. You can also think about checking out Dr. Ellie Phillips, a dentist on YouTube, who recommends certain oral products and a certain order of using them to maintain optimal microbiome. So the things that disrupt this secondary pathway, nitrite to nitric oxide, is inadequate nitrate intake, disruption of the mouth microbiome, antibiotics, antacids, which would cause that low stomach acid, and we need high, and disruption of the gut microbiome. So, as we talked about before, people will experience different symptoms dependent on where the microvascular disease is impacting the brain. And so in the limbic system, if that's a part that's affected, or other parts too, then a person can experience depression. And so this is not an old Chinese medicine formula, it's a new formula, but something to consider if you are experiencing depression secondary to your cerebral microvascular disease. Something else that's very important is manual therapy for the lymphatics as you're dealing with a microvascular disease. We want to drain the lymphatics, clear congestion from the cerebral veins and arteries. Remember all that stickiness and that slowed flow of blood. We want to get everything moving out of the head so that it can move back into the head. The other nice thing about working with the lymphatics is that you're actually working with the astrocytes to bring up function, and you're helping to detox the brain. And so there's lots of good things that are happening as you're draining the lymphatics with manual therapy. So in conclusion, early intervention is key. We want to slow, stop, or reverse cerebral microvascular disease. My dad always said, your goal is never to be the hero. Your goal is to intervene before the patient even knows there's a problem, and fix it before they become symptomatic. If you can do that, you are at the top of your game. And so that's what we want to do with natural medicine. We enter into treatment earlier than biomedicine does because we want a higher state of health. Cerebral small vessel disease is not a normal part of aging. It is common, and certain steps must be taken to decrease its expression. We must reduce inflammation, stress, and the consumption of processed foods and trans fats. We have to optimize blood pressure, blood sugar, insulin, sleep, weight, and thyroid function. We need to increase exercise, fruits, veg, and fun. And if you already have findings on imaging, then you definitely will need to take supplements to reverse, slow, or stop progression. Thanks so much. This is Dr. Caroline Peterson at Natural Women's Health Institute in Sarasota, Florida.